Okay, now the raging COVID third wave, Delhi's prominent centre-run Lady Hardinge Medical College has issued a bizarre circular. The order says that health workers exposed to COVID-positive patients will need to continue working with a tight-fitted N95 mask, irrespective of the degree of exposure. Now, they must keep an eye out for any symptoms they develop. Now, this order also comes in the wake of over 400 doctors testing positive for COVID in Mumbai and Delhi. For healthcare workers who test positive but are asymptomatic or experiencing mild symptoms, the hospital has advised 7 days of home isolation. Now, through this circular, we have told health workers to continue working with tight-fitted masks until symptoms develop, is what the hospital is saying. Okay, my colleague Ayushman joins us for more on this. Ayushman, what is the rationale that's been given by the hospital in this case, and what is the reaction coming in from the doctors there?
Well, the resident doctors definitely seem to differ from the idea of the hospital authorities. They are saying that somewhere the adequate quarantine facility should be given and the testing should be upped. This should not be the case that the doctor should be told to come to work even after getting in contact with the person who has tested positive, because initially, Aarti, when we had spoken to the hospital authorities, they had said that this has been done keeping in view of the depleting manpower that they have. Over 40% of their doctors and the healthcare workers have contracted infection, and the numbers are rising, and they mixed the CDC guidelines along with the health ministry guidelines in order to circulate their own circular, in which they have asked the doctors to come to work with tight-fitted masks and maintain a distance and then treat the patients. And if they develop the infection and if the symptoms come, then they can go for testing and follow the health ministry's guideline, I beg your pardon. So here the doctors, resident doctors, have urged here the officials to change that quarantine norm, which they are currently saying that you have to come to work. They want adequate quarantine time and also adequate testing facility for the doctors as well as their family members.
Okay, Ayushman, stay with us. Dr. Vinay Kumar, Resident Doctors Association, joins us. Dr. Kumar, good evening. Thanks so much for speaking to Mirror Now. If you've seen this circular, how do you react to this? Do you think it's fair for healthcare workers to be told, get on with the job, it's okay if you're unwell?
Yeah, as far as nation is concerned and common public is concerned, I appreciate this whole decision. But as far as individual level, my point is that we, the healthcare worker, who are the frontline worker, and we are exposed daily with certain kinds of diseases and certain kinds of infections. So I think, in my personal view, there should be a proper quarantine guidelines as that was in first wave should be for healthcare workers, because we are the only one who come in direct contact with the patient, and after coming in contact, we take this infection to our home. So I would like to request with the platform of Mirror Now that government should reconsider this quarantine policy for healthcare worker also, and they should be given adequate quarantine time or some adequate staying facility till their duty is concerned.
Well, Dr. Kumar, several of our viewers actually may not perhaps be completely aware of how difficult it is to be a healthcare worker, how difficult it is to be serving in COVID wards at a time like this. And in that backdrop, this particular circular that comes is further a burden to them. Just give us a broad overview on how difficult these times have been for our COVID warriors.
Yeah, I actually cannot point this in words, but it is a feeling that you have to be in PP for at least 6 to 8 hours in the ICU or ward, and you cannot go for even for natural calls. So you cannot drink water, you cannot take food, you cannot go for toilets. So it's very difficult for any healthcare worker who wear PPE, and you cannot breach that PPE just to save just to so that you cannot get any infection. And meanwhile you have to work as I am in critical care expert, so I have to work in ICU, and with that goggle which have fog all around, in its glass, it's very difficult to see even the patient parameter. But what we have to do, we have our duty, we have to switch to it, and it is a priority call for us to
Yeah.
save our patient.
Mhm.
So we have to stay inside, we have to be with the patient. Sometimes we have to treat, and sometimes we have to give suggestion, we have to boost their morale also. So actually it is difficult, but we somehow used to it,
Yes.
and now we enjoy our duty.
Well, Dr.
we
Kumar, that's
we
exactly
we,
why the nation is
we
truly grateful to you and your services. I thank you so much for speaking to Mirror Now. We have Dr. Sunil Duchania, who is in fact the Lady Hardinge Medical College resident doctor president. Doctor, thank you so much for speaking to Mirror Now. You've seen the circular. In fact, you and several of your fellow doctors are going to be having to power through work, even if you are unwell or even if you've tested COVID positive. What would you like to say to the authorities?
Actually, we got the letter on 5th of January 2022 regarding the COVID duties that despite the exposure with the COVID positive patient, we need to continue work while wearing a tight-fitted mask and to maintain social distancing of at least 1 meter. Definitely, it is not acceptable, and at some point of time, we are considering the COVID as a mild disease. Yeah, definitely, it is milder form than Delta 1, but it may be a big mistake. So we need to be very serious now, and we have requested our authority. We have written a letter today to reconsider and do necessary amendment in the guidelines.
And what if they don't, sir? What if they say that, no, we're going to have to go through this? Because the explanation that has been put forward by the hospital is twofold. One, they're saying that there are several doctors who are already unwell and we can't afford to lose more. And the second, they've cited the US protocol by the disease control that's been cited there to say that this is justified.
Yeah, today itself we have written the letter. Let us discuss with the authorities. We will convey whatever will be the decision.
Mm-hmm.
Yeah.
Well, just one final question to you, and it was this question that I even asked Dr. Kumar earlier. Give us a sense of how difficult these times are. A lot of people will be saying, well, so what, get on with it, come to work, that's what everyone else is doing. But the plight of the doctors, the plight of healthcare workers, of nurses is not discussed enough in terms of how difficult it really is to be serving in COVID wards.
Yeah, basically, like we have worked in the COVID first and second waves, and now this Omicron, and every healthcare worker is working as a frontline warrior. And we are actually pleased to serve the nation this time also, wearing PPEs and working 24 hours in the OPDs and wards and whatnot. So this is something that creates, or it is definitely something very, very much need to be appreciated. But recently you have seen lots of incidences and something that is not in support of the resident doctors. And we need to, we did the protest in last approximately 1 month for the NEET PG counseling. So looking the ground situation of the COVID and the third wave of Omicron, recently and today itself we got some good news from the Apex Court that our juniors are going to join as soon as possible, and definitely we'll be having that much manpower so that we can work with the enthusiasm. Hello.
Yes, please go ahead. Please go ahead, doctor.
Yeah. So that's why, as I said, that we keeps on working in the OPDs and wards, wearing PPEs during tough times. And in the summer, it is unbearable to wear a PPE. And it is very difficult to breathe while working, and sometimes it is very common while working to get exposed from a COVID positive patient. And our sole motto is to save lives and to serve the nation. And this should be considered the utmost priority for the healthcare worker. And we are ready to serve this time also, and we are there. For the people of India, we are there to serve the nation. We are there to help each and every resident of this nation. We are there to help them once again.
Well, Dr. Sunil, just one final question before I let you go. You've mentioned, of course, how difficult it is, how trying it is. Do you think government authorities, any government authority, bureaucrats, they pay a lot of tribute to doctors, but they don't actually understand what happens? They don't really understand what you're going through and are insensitive and inconsiderate?
Yeah, actually, this is the ground reality because just giving the name of COVID warrior, just doing or just saying that these people are similar to God is not enough. Ground reality is something different. We also are human beings. We also have families. We also have friends, and it should be considered. We definitely ready to work 24/7 to serve the nation, but we are also human beings. We need rest. We need to care for our social as well as the physical and mental health also. So it should be considered. Yeah, definitely our government is working very well for us, but it should be considered. The health of the resident doctors and the healthcare workers should be on the priority basis, and the necessary arrangements should be there.
Okay, thank you so much for speaking to Mirana. I just want to say that the entire nation does stand by you. What you're going through and what you're providing the nation, the kind of service that you're providing the nation is something that we'll always truly be grateful for. And it's really unfortunate that even when you're unwell, you're being forced to work. Dr. Jailal, who's the IMA President, joins us. Dr. Jailal, you've seen the circular that's been issued by the Lady Hardinge College. What would you say to it? Do you think that this is a case of extreme insensitivity and discrimination?
I fully endorse your view. It is an extreme step of indiscrimination and insensitiveness, and more of, I will say, even to the sadistic mindset. And yes, we understand that the COVID number of cases are increasing every day, bit and bit. But we are also, the doctors should be also the human beings. What is the problem with the government? They know for sure we need more manpower. But you see that it is, instead of taxing the doctors who are already succumbed to the various kinds of diseases and tension, they can appoint hundreds of doctors who are waiting outside, willing to come and serve in the country. There is every year 85,000 doctors are coming out of the medical college, and even if you say only 40,000 is going to the post-graduation, that means there is in any part of the country there is lakhs of doctors are there without job, waiting for the government to get them appointed. In this critical situation, instead of putting the doctors into the further harassment, the government should come out and make an emergency appointment for the willing doctors to come and serve them. They can pay even for the minimum cost. They are willing to do that, and that option is in front of them. They are ready to spend crores of rupees in the infrastructure, but they are not willing to spend money for the manpower. That is only worrying us. So now the SE has given the verdict for the PG counseling. That should be expedited, so that another 40,000 people will be coming in. But equally for this, at least for the 2 months or the 3 months, government should now make a call and appoint hundreds of junior doctors in the hospital so that they will be in the frontline warriors and help, instead of going into such a sarcastic, sadistic attitude of penalizing our doctor community, which are working with the great altruism in the hospitals.
No, certainly, Doctor, and at a time when so many of your colleagues are already overburdened and overstretched, now to tell them please also work when you're unwell is beyond unfair. Just one final question to you. The government, or rather the hospital authorities in this case, are saying we're just quoting what the US drug control or the US disease control authorities say. This is what the international practice is and this is what we're following. What do you say in response to that?
Absolutely no. This is not the international standard. Then they should also pay the international pay which they are paying. And is it they are going to, when they say about the payment or the facility they are giving to the resident doctors, they say it is India is a poor country, so we will be able to give only this. But when want to the people to work for 24 hours, they will quote the US. It is a hypocrisy of the government. And why should they use? If they want to stick on to the policy of the US, let them follow it every bit of the stuff they are doing. And their doctor is expected to see one patient, and minimum 45 minutes he needs to spend. The junior doctor has to spend. So then hardly a junior doctor has to see not less than 30 cases he can see a day. But here it is, unfortunately, a junior doctor is expected to see hundreds of patients per day. So let us not compare the standard of practice which is adopted in US and use that as a stick to make 24 hours work for our junior doctors. This is absolute hypocrisy, and we need to talk in terms of Indian setup. There are doctors available. Let the government come out and appoint them and let them use them for the purpose of serving the community.
Okay, Dr. Jailal, thank you so much for speaking to Mirana. Really appreciate you joining us with your views and insights there. Perhaps something that all our authorities, be it at the hospital level or be it in terms of the government, need to take note of what you were saying.